Distributed ledger technology based integrated healthcare solution for Bangladesh. Outline. This video is divided into three sections. First, there will be an introduction, then the theory briefing of this project. After that, finally comes the application prototype section, where our applied research work will be demonstrated with cross-platform experience. Objective and motivation. Our objective is to decentralize healthcare service and its administration process in national level so that every data can be preserved with well documentation, so that we can establish a fair and strict monitoring on corruption in these sectors with all this live documented data, and also to develop a great customer relationship management system which can remove the communication gap among the authority and the customer and consumers. Motivation. As our system is preserving all this medical data in a well formation and structured way, our mission is to convert our healthcare system into a kind of tree whose each node will collaborate with science and engineering in order to open a path for the future. We are aiming for a day where we can see healthcare in a technically self-sufficient position which will provide the general people with fast and automated medical service. Problem statement. To ensure the healthcare services, there is a dedicated ministry in Bangladesh. So as the ministry is operating in national scale, there is a huge budget maintenance and its official flow of documentation runs on its every working day. But as the ministry is running in national scale and deals with a huge population, it is accused with some allegations. For the lack of proper and fair management, documentation and records can be manipulated and allegations will take place. As the ministry operates in a national scale, a massive communication gap occurs among the authority and consumers. Anyone can take advantage of these limitations, and any officials related with this service can raise their value of qualification by using fake documents. In Bangladesh, our national level healthcare service is still operating with paper-based documentation. These hard copy documents also need to be stored for the official formalities. But as the ministry serves almost 163 million people across the country, the population of storing all these hard copy documents cannot be served properly. Due to lack of monitoring, some official personnel are taking advantage of it. As an example, the rural people sometimes faces lack of doctors in their areas, and some government doctors can be found practicing in the private chambers. In Bangladesh, we can see a common scenario that some doctors are forced or influenced to prescribe medicine which are distributed by private distributors. Every year, a lot of news can be found in our national dailies which claim the evidence of corruption in national healthcare. Government-free medicines are getting sold in most common scenarios among those. Though the People's Republic of Bangladesh try to improve their service and prevent corruption according to the feedback of the general people of the country, but the ministry is so big and deals with a huge population, the higher authority cannot get proper feedback from the citizen. And the current process causes much hassle for a common man. So people just avoid the complaining process to the authority whom it may concern and criticize the system on social media platform. Followed by this problem, we have a proposed solution which can arrange all this documentation in a digital form with a well-structured process. So each data can be neutral for a fair monitoring. From the preserved medical data, every citizen and appointed doctor can check his or her current and past medical records and easily judge the patient's health status. Previously taken medicine history can be also checked for avoiding any side effects. Prescription. This can be an ideal document where all other digital medical features merge together. Here, every patient will be documented with proof that he or she was served by a duty doctor in a particular date and time. Patient get his or her medical document from this online portal whenever he or she need it. In the appointment segment, patient can place an appointment remotely. This system will store the duty doctor's working hours and educational qualification. This system can simplify the searching process of a doctor according to the patient's disease and nearest location, so that the sick patient can easily place an appointment without any difficulties. Most importantly, the complaint segment. Here, if any citizen is not pleased with the services, he or she can just place a complaint. Patient's documented medical record with its date and time can be used as an evidence for investigation and taking action. With online portal, citizen can also track the complaint status. As our proposed solution based on private DLT, it has a strict governance process from the starting of its development and during its every functional step. First, there will be a dedicated certificate authority server for the orderer itself and every organization individually. These servers will certify the node for existing in our DLT network through MSP or membership service provider. Each organization will hold an admin of its own. For the frequent response, only the organizations will hold a world state. Here, each of these nodes can have multiple peers, but the organization starting peer will be known as anchor peer, and other will be gossiping peer. The peers of the orderer will be for consensus mechanism. In the organization, each admin will be responsible for enrolling the user with MSP who can access our private DLT as an actor. Strength. The system's strength lies in the fact that it will convert the analog healthcare system into a fully digital system. It will also provide us the huge resources of data which can be used to further enrich the system for its users. The whole system will maintain the industry relevancy and only the technology suits are used. The privacy and transparency can be fully controlled by the administrator of this system. It will help the nation turning into a smart nation. Uniqueness. Healthcare in Bangladesh is a sector where both government and non government organizations work together, but the services are not fully digital. Our solution makes these services digital using decentralized architecture that provides greater security and transparency. Our solution also provides seamless communication between these different government organizations in the healthcare sector, which generally improves the user experience and gives us the information we need to improve it.